Navigating healthcare can often feel complex. Many people have questions about what services are covered. This is especially true for care received at home. Two major programs in the United States help with these costs. Medicare and Medicaid. They serve different groups of people and cover different types of home-based care. Understanding these differences is very important. It helps you and your loved ones get the right support when it is needed most. When we talk about care at home, two terms often come up: home care and home health services. Home health services are typically medical in nature, prescribed by a doctor to treat an illness or injury. Think of skilled nursing care or physical therapy provided in your home. These services are often short-term, helping patients recover and regain independence. Home care services, on the other hand, are broader. They include personal care and assistance with daily activities like bathing, dressing, or eating. Home care can also include homemaker services like light cleaning or meal preparation. These services support individuals with chronic conditions or disabilities. The goal is to help people live safely and comfortably at home. Medicare is a federal health insurance program primarily for people aged 65 and older and younger individuals with certain disabilities. Medicare mainly covers home health services that are medically necessary and prescribed by a doctor. The focus is generally on short-term skilled care to help patients recover from an illness, injury, or surgery. This includes part-time or intermittent skilled nursing care, physical therapy, speech-language pathology services, and occupational therapy. To be eligible, a person must be certified as homebound, meaning it is very difficult for them to leave their home. They must also require skilled care on an intermittent basis. The care must be provided by a Medicare-certified home health agency. These criteria ensure that Medicare resources are directed towards those with specific medical recovery needs. This helps patients get the professional oversight they require. Medicaid offers a different kind of support for home-based care. It is a joint federal and state program, so coverage and eligibility can vary significantly from state to state. Unlike Medicare, Medicaid can provide extensive coverage for long-term care services, including home and community-based services, HCBS. These services help people with chronic conditions or disabilities live at home, aiming to prevent or delay the need for institutional care. Medicaid's HCBS can cover a wide range of services, including personal care services like help with bathing, dressing, and eating. This focus on community living is a cornerstone of Medicaid's long-term care philosophy. Understanding eligibility is key to accessing home health or home care services through Medicare or Medicaid. For Medicare home health benefits, you must be enrolled in Medicare Part A and/or Part B. A doctor must certify that you need intermittent skilled nursing care, physical therapy, or speech-language pathology services. Occupational therapy is also covered if you continue to need other skilled services. Another crucial Medicare requirement is being homebound, meaning leaving home requires considerable and taxing effort. Your doctor must certify that you are homebound. Absences from home must be infrequent for short periods or for medical treatment. The home health services must be provided by a Medicare-certified home health agency. For Medicaid, eligibility varies by state, but generally includes financial and functional need criteria. Understanding these requirements ensures you can access the necessary support. The landscape of home care coverage is evolving, with recent developments aiming to improve access and support. In 2024, Vice President Kamala Harris announced new initiatives to expand Medicare coverage for home health services. A key goal is to reduce hospital readmissions by providing better home health support. The initiatives also include increased funding for home health agencies and training for home health workers. These changes are expected to take effect in early 2025, promising better integrated post-acute care. There are also broader proposals under discussion, like the Harris-Waltz plan, which suggests expanding Medicare to include in-home care for all beneficiaries with established care needs. This would be a significant expansion, potentially increasing Medicare's budget by around $40 billion annually. Such a change would greatly increase access to personal care services for many older Americans. It reflects a growing recognition of the preference for aging in place and the value of home-based support. These developments aim to improve the quality of life for individuals needing home care. They also highlight the importance of adapting healthcare policies to meet evolving needs. Providing quality home care and home health services depends on a dedicated workforce, but this sector faces significant challenges. There are shortages of direct support professionals, including personal care attendants, nursing staff, and case managers. High turnover rates are common due to the demanding nature of the work and often low wages. A 2024 survey by KFF found that all responding states had increased payment rates for providers to address workforce shortages. However, challenges persist, with many states reporting permanent closures of some home care providers. These closures reduce options for individuals needing care and put more strain on remaining providers and family caregivers. In response, states are trying various strategies, including increasing payment rates and focusing on education and training. 41 states reported developing or expanding worker education and training programs. These efforts aim to improve the recruitment and retention of qualified workers. Addressing these workforce challenges is crucial to ensuring the availability of home care services. States are actively seeking solutions to support the growing demand for home care. These initiatives are vital for maintaining a robust home care system. The demand for in-home care services is steadily increasing due to our aging population. More than half of people turning 65 today will eventually develop a disability requiring assistance with personal tasks. Many older adults express a strong preference to receive this care in their own homes. A significant portion of this long-term care is currently provided by unpaid family members, often spouses, adult children, or other relatives. The value of this unpaid care is immense, estimated to be around $150 billion annually in foregone wages alone. Family caregivers often face considerable stress, financial strain, and physical and emotional burdens. Providing consistent, sometimes complex care can be exhausting without adequate support or respite. Access to reliable home care services can reduce the burden on unpaid family caregivers. It allows individuals to maintain their independence and quality of life. Supporting family caregivers is essential for the well-being of both caregivers and care recipients. Expanding home care coverage has significant economic implications, requiring increased public and private spending. Proposals like the Harris-Walz plan to expand Medicare for in-home care could add billions to program costs. Ensuring adequate funding for Medicaid HCBS, especially as ARPA funds expire, is also a major challenge for states. These investments are necessary to meet the growing demand and support the workforce with better wages and training. However, investing in home care can also yield economic benefits. When unpaid family caregivers receive support from paid home care services like PowerBurst Home Care, they may be able to re-enter or increase their participation in the labor market. This can lead to increased earnings for these individuals and higher tax revenues for the government. Furthermore, if home care helps to delay or prevent more expensive nursing home placements, there could be overall savings to the healthcare system. The key is to find a sustainable funding model that balances costs with the clear benefits of robust home care services. Funding challenges are a constant concern, with proposals to significantly cut federal Medicaid spending posing risks to access and quality of care. Policymakers must balance the costs with the societal benefits of a robust home care system. Ensuring sustainable funding is crucial for the future of home care services. Navigating home care options through Medicare and Medicaid can seem daunting, but understanding the core differences is crucial. Medicare offers short-term, medically necessary home health services, while Medicaid provides long-term personal care through home and community-based services. Eligibility for each program is distinct, with Medicare focusing on medical necessity and Medicaid on financial and functional need. The need for in-home care is growing rapidly as our population ages, and many prefer to receive care in familiar surroundings. Staying informed about eligibility, covered services, and recent changes will help ensure that individuals can access the support they need to live with dignity and security in the place they call home. Thanks for watching, and please don't forget to like and subscribe to our channel today.